Hello. So today we'll just start with explaining what you do in your companies related to functional food. Well, on my side, I'm consulting agency for all plant-based alternatives. And first time I was introduced to functional food, it was 7 years ago in Canada. So there's a lot of talk about it. But this is what we're going to do right now. It's explaining functional food and what we have to do to improve the connection with the people, the customers. So Matthew?
Hi, I'm Matthew Tebeau. I'm the responsible for strategy and partnering at Proteon Pharmaceuticals. We actually are a biotech company developing, we've developed a platform to use bacteriophage to modulate the microbiome, reducing the impact of pathogenic bacteria. We've started in animal health. We're here as a culmination of a strategic review of how bacteriophage could be used in functional food or personalized nutrition or food as medicine, which I think we're going to talk about a definition of functional food today. But our product would fit within that as potentially as an ingredient.
Great. Hi, everybody. Gil Horsky. My background is I've been working for, until the beginning of this year, for 16 years for large multinationals in the food industry, mainly actually selling snacks, probably not the healthiest ones. So worked for Pepsi many years, for Kraft Foods in Mondelez. And I've been on the corporate journey of trying to help some of these companies move to healthier ingredients. Obviously, it's a long journey for big companies. And I decided at the beginning of this year to jump ship and to move to the evil side of this gentleman and to become an investor, and founded FLORA Ventures. We're a new VC fund, and we have 7 pillars that we're interested to invest in them. And one out of the 7 is actually the one I'm most passionate about, which is food as medicine. And I'm a big believer that that's going to be the biggest or one of the biggest topics in the food industry in the coming years. So excited to join you guys all today.
Hello, everyone. My name is Giancarlo Addario. I decided to move to the evil side 5 years ago. Prior to that, I was working at Barilla, a large corporate that most of you might know, dealing with healthier foods and a lot of research on functional foods already there. But now in my new role as a principal at Five Seasons, functional food is still a target. We have 2 companies that apply functional food in their products, in their offer. One is Her1 in Germany, who does inner beauty. The other one is a pet supplement company in Germany called Mamali, and they also have functional food for pets in that kind. So we make the focus broader and broader as we speak. Few words about Five Seasons. We are based in Paris. We have a European focus. We are a venture capital fund and food tech only. We have a strong focus on the later part of the supply chain. We only invest in food D2C, B2C brands. And we invest in a Series A and B rounds, so tickets from 2 to 10 million. And that's pretty much all of it.
Okay, thank you. In order to start the topic, how do you, what is the definition for each of you of functional food?
I'll start again. I think we've heard today different definitions of food as medicine, precision, nutrition. I think for me, functional food is more prosaic, and it's something that that Europe and the U.S. have engaged upon for actually hundreds of years. If you do look at food history, you'll find that functional food is well embedded to the pre-Renaissance era. And I'm going to quote a French surgeon from the 18th century who defined functional food, I think, the following way. There's only one way to be in perfect health, but 1,000 ways to be ill. And he was arguing for food as a prevention of disease and a maintenance of health. And that's what I see functional food as.
Yeah, I mean, I like to look at the problem and then, and see if there's a solution, what's the way to solve for it. And if we think about it in a simplistic way, I think most of us know the data that, if you look at the causes of death, if you look backwards, what is the cause of death? The highest cause of death at the end is connected to food and nutrition, one way or another. So definitely, I think that food, if we look at it the other way, is, right nutrition and food can actually prevent death, or, can make all of us have a longer life, that it has higher well-being, et cetera. And I think one of the interesting things you see is, I, for example, sit on a board of a company with an investor that is a healthcare investor and medical devices investor. And one of the questions I asked him once, why did you invest in this food tech company? And he says, listen, my entire career I've been investing in companies that are solving a problem once the person becomes ill, right? I mean, that's what you do in the pharma world or medical devices, where somebody's ill and you're now trying to cure them. But actually, if you think about it in a simplistic way, if you invest in healthier food, functional food, sugar reduction, et cetera, in a way, you're actually preventing people even from becoming ill to start with. So I think it's an interesting notion, and I think that's one of the reasons we're starting to see also more investors from the healthcare, from the biotech side, actually trying slowly to move into the food side.
So I was a little scared when I had to think what is functional food is such a broad. So I tried to ask ChatGPT here.
Loving it.
So my ChatGPT on paper says, okay, first of all, prevention, performance, third, recovery, post-workout recovery, or recovery from if you get drunk. So that's just to create a perimeter around what you can say, because we have only 20 minutes and stuff. Then I try to do a kind of brainstorming on what are the subsectors right now on the shelf. So I'm trying to, because we have listened to very interesting, insightful panel on personalized nutrition, and we have listened to interesting panels on food as a medicine. So everything that had to be said has been said, but I think, okay, let's try to see what people actually find on the shelf when you go there. And I was thinking about ingestible beauty, biohacking and nootropics, so supplements to improve and to prevent, if we think about healthy aging. So how do you prevent the healthy aging process? I was thinking about femtech is another area that now is raising a lot in terms of functional food, energy drinks. The first one, Red Bull. We all think about Red Bull. It's we can go back to history, go back to coffee and other stuff. I mean, that's functional food, of course, to improve performance. And last but not least, all the area of gut health. That is the most common, and that's your area. I will not tell anything about that because that's your area, Matthew.
Okay, so well, Matthew, maybe you can say more about this part.
Yeah, I think so. If we think about the microbiome, I think there are just a couple of things we ought to understand as basic, and they're often missed. First of all, the microbiome's incredibly stable. This idea that you can rapidly and easily transform the microbiome is a complete myth, and it would be the holy grail, but it's really not possible. So microbiomes are stable, microbiomes are personalized, but when we think of personalization, we shouldn't be thinking about personalization of me, but personalization of groups, because you can't commercialize anything if you don't have groups. Otherwise, you're going to go into this kind of insane situation where claims and everything get so confusing, which actually is a little bit where we are now. There's a lot of claims and confusion. And third, when we think about the microbiome, what we know is vastly larger than what we know and will be for at least a decade even with AI. So we're very much at the beginning. Functional food is already, in my view, because of advances in science and regulatory understanding, entering a golden age. And you don't have to be it doesn't have to be high science.
Yeah, that's what I was thinking about. Actually, a lot of big words, but for the consumers, maybe not that simple, because you said that it's simple, basically functional food, but only the terms, the two words, it's not that easy to understand for the consumers. So what can we do to help them understand what is functional food and how it's good for them? So answering the question, basically.
Before I answer, just one question. Actually, what is the reason that microbiome, I always feel like it's been talked for many years, but I've not seen it actually translate into significant businesses in the industry. So
I mean, the really short answer is there are more non-U DNA. There is more non-U DNA than U DNA in your body.
Okay.
So the volume of the microbiome and how it's different in different places, your skin, your gut, your bloodstream, et cetera, it creates such complexity. And that is the gap.
Okay. Thank you. For the question on the consumer, I think, I started my career in marketing and, worked and talked with many consumers in my career around the world. And I would say, by the way, we're all consumers, right? And at the end of the day, we all like things that are simple. Consumers don't think, we always think in complex business models and complex science, et cetera. Consumers at the end have needs and problems, and they want them to be solved. And the more you can simplify it, obviously with the right regulatory framework, meaning I think it was also mentioned in the panel before, there's a limitation on what we can claim and rightfully, and we can't just say kind of things that are not scientifically proven. But at the end of the day, consumers want simple things that are clear. At the end of the day, when we're going to shop in a store or online, we make decisions within a fraction of a second. And I think the more you're clear, you have a clear benefit, what I would get if I eat this or that every day or whatever that is over a longer period, I think the better. I think what happens with the industry is one of few things. Either we basically very much complicate the messages to consumers as manufacturers or brands, et cetera. Or two, there are certain categories, and a good example is the CBD. Again, it's always interesting for me to see how, 2 years ago you would go to these conferences, everybody would talk about CBD from morning to night. Now you say CBD and you're not invited for the next conference anymore because it became less hot. One of the reasons, by the way, is CBD, I think, is it's actually not the fault of CBD. It's the industry's fault. The whole category in certain markets was not regulated. And a lot of players came in and basically started claiming, just give this to your dog and your dog would have wings and would fly. And I mean, people were just believing that or claiming that you can do everything with CBD. And of course, what happens at the end, you quite quickly become, in consumers' mind, labeled as a snake oil. And you basically lose credibility. And I think that's, unfortunately, what CBD is facing today, among other issues. But actually, CBD, as we all know, has some benefits. But I think it was overused. So I think at the end of the day, it's also about, even if the framework is not ready yet, I think as manufacturers or brands, everybody has to be responsible enough to actually claim things that make sense.
Yeah, actually, I was thinking about that because we were supposed to say less science and more marketing, but there is a middle in between, like you said, for the CBD. So, Matthew, when we talk about it, you told me something very interesting. It's that here we see the end of the road with the consumer, but what we can do in the beginning of the road to make functional food more accessible for people or maybe for companies?
Yeah, I mean, we're, from the startup perspective, not on the evil side of the financiers, I think a challenge is to be able to build your story. There's a lot of great food being tasted out here, and these companies seem to be fairly early stage. They haven't finalized their claim, and when you're building a product, you've got to build a lot before you get really a lot of customer feedback. And I think that's one of the biggest challenges. You know, how do I get the taste right? Marketing, you'll try it the first time. The second time, though, you come back because of taste. And then there's the ingredients. And to me, this is really also, I mean, coming from biotech, where there's science underneath, this is really confusing. That's hard.
Plus bioavailability, it's tough to pronounce as well. And that's another issue that needs to be taken into account. And the trade-off between good science and good marketing, good branding, you have to be very solid as a science base, but you have to be less scientific when you tell stories to consumers. And that's always a huge trade-off that needs to be solved, because the more complex is your speech, the less effective will be. But on the other side, if you don't have a good, strong, solid science, you are selling, you are cheating, basically. So that's...
So how do you make decisions on companies?
Solid science background, good marketing, good brand building. That's the recipe in 3 words. Plus, we have, you know, Matthew, you don't have that problem in the US. We have something in Europe, it's called regulatory.
Yeah, everything in the US is grass, and here you have EMA. And,
yeah, we cannot say anything. And I don't want to be, yeah, of course, I won't be too much provocative, but I don't think that helps, because it's not asking companies not to tell things that can improve a transparent, trustful communication.
Yeah, it darkens the message, actually, all this non-talking.
But I think just one thing I want to build on, you were asking how do we make it more accessible. I think, you know, when you were talking about the startups outside and in general, I think, you know, most of the things we see today in general in food tech, for sure in the more food as medicine space, but in general, most of the things we've seen in the last few years are always about premiumizing, right? It's more expensive ingredients, they're going to be more efficacy, they're going to have more benefits. The issue we have is, right, food has low margins relatively. You swap one ingredient with another one. If it costs much more, the manufacturers are never going to take it. But on top of it, I think today there's a notion that if you want to have healthier, better ingredients, or for sure things with benefits and efficacy, you need to pay a premium. I think for us as a challenge as an industry, and I put it everybody in the industry, I think we need to challenge ourselves in the long term. How do we actually deliver nutrition in an affordable way? So I think it needs to be nutrition plus affordability. Today, that equation, nobody's even talking about that equation. Actually, everybody's talking about nutrition plus premiumization. But actually, if we really want to fight all these obesity, all these issues we're talking about, actually, the way to do it is, can we deliver nutrition in an affordable way? I don't have the answer, how do we do it? But I think, you know, at least starting to talk about it and having that as a challenge, I think is a good beginning. And I unfortunately don't see, and I see even on the investment side, obviously we all want to invest in companies that are premiumizing because we have a higher margin. But if it's the right thing to do, obviously affordability and accessibility has to be a huge topic that we start talking more about.
Oh, okay, so we have the investing side, we have the ingredient side, but let's talk about the consumer side, which I am. At the end of the day, like you said, we want simple things, but we also want tasty products. Maybe there's something to do about that. We want to enjoy the food we eat. So if it's positive, it's good for you, for your health, for anything else, but if it's tasty, maybe it's better. So what you have to say about that, and maybe the relationships we have with food has to change, or companies have to target their consumers, their market better. Just tell me what you think about.
Yeah, format is key. I was at Vita Foods in Geneva, and you can see what's going on, because what is the extreme part of functional food is pharma. I take a pill that is good for me. Now, pills are supplements, and first of all, they have to be multi-ingredients. They have to be multi-purpose. Sometimes supplements are very important for people that are undernourished. And I saw a very nice company in the US who's also funding projects for that. So the pill is starting to be funnier with all these colors that show different ingredients inside. And the pill is turning into a gummy. So from pill to gummies, then to gummies to a wider food experience, much closer to food than to a drug. So I think this is the path that the functional food. On the other side, we have food that are naturally functional, like, I don't know, extra virgin olive oil is something that it's functional by itself, and it brings experience by itself. But I think that the pathway to become more affordable, more enjoyable, to provide a better experience to consumers is to to enrich that part.
I hesitate to answer with the marketing expert next to me, but I think if we, especially when we think about taste, which is your question, which is highly personal, and functionality, as you've said, almost you'd want to do what Patagonia has done, which you focus on a audience, you serve them extremely well, and you build from that. Because not everybody's going to like the flavor, but if you have a group of people in mind for whom that product really is something they like and will have an impact, then you're going to achieve some scale of success, and I think that's something you can build off of.
Yeah, you told me about all the targets that we can have with functional food, just like sick people, elderly people. Can you tell me more about that?
Yeah, so one of the challenges for a new category, and bacteriophage as a category is completely new. We've really had to look at segments. So and I think there are quite a few companies here doing this, that you say, I'm going to target the elderly, I'm going to target pediatrics, I'm going to target athletes or people who are very oriented to nutrition, pre-diabetics, obese people. We've talked about some of these groups. There may be other groups as well. For instance, this morning there was somebody who was talking about reducing sugar content. Well, that might be good for some of the snack companies or drink companies who have essentially an unhealthy product that they have to, because of the way we think, have to improve the quality of.
Yeah, I mean, I agree with everything that was said.
Wonderful. Okay, so if we want to highlight the point that we just talked about, so the first thing to do is to give the ingredients to the companies that are making foods. So that's the first thing we have to do. And on the investors' side, jumping in it, functional food, it's the future, you said it, you already invested in some companies. So maybe this is where the message can be spread like that. Also less science and more marketing. This is what we were saying, but we also have to be science-based in order to make some claims. And making the best products with the best taste, or the more functional one for your target that you have. I think that it concludes everything. If you want to say something more about the topic? No? You think we covered it? So my last question for you will be, what is your favorite functional food? To me, for example, it will be coffee. I'm a big coffee fan, but that's myself.
I would say I've really been turned on to freeze-dried meals. because they're much healthier than ordering fast food when I don't have time.
I'm a big fan of bars, and I think I very much agree with the comment that was said before about format. We've seen a lot of research over the years. Consumers want to have things that fit their daily lives. Snacks do it very well. And that's actually why snacks can play such a big role in people's lives in the space of food as medicine. If you ask a consumer, do you prefer every day to eat a pill or a powder that need to start doing a smoothie, or just a snack on the go or a little cube or whatever, they'll always choose the bar option. It just fits their lifestyle much more, and it doesn't feel like you're actually eating a medicine. You're actually doing something fun. So I'll take a bar.
I'm a kind of old-fashioned. I still bet on fermented product, yogurts, and not only, because there are a wide range of fermented products, plus prebiotic fiber. And I bet on microbiome. There is not enough science evidence. There is a lot of studies, a lot of research around microbiome, but I hope that that will be the future for functional foods.
I hope so too.
Okay, thank you. If you have any questions in the audience, please do ask.
Yes, question time, but no microphone. Yeah, back. Anyone would like to ask a question before lunch? Last opportunity. Then only after lunch. Looks like we have no questions.
Okay, thank you.
Thank you.
Thanks.
Thank you. Thank you very much, Florence. Thank you to panelists.